Physical is a physical assessment simulator that can be used in a variety of simulation settings, like at a doctor's clinic or at the hospital. Physical can facilitate training in several examination skills, such as checking pupillary reflex, taking blood pressure, listening to heart sounds, checking pulses, listening to lung sounds, listening to bowel sounds, and taking an ECG. Today, Physical is having a rough day.
I don't feel so good. My chest hurts.
Physical is complaining of chest pain. Her observations 2 hours ago were within her normal limit. She was admitted yesterday for new onset of chest pain, but before this admission, she had no other significant medical history. I'll take another set of vitals. Can you please help me with an ECG? Remember to reassure the patient by staying with them and maintaining communication. This is also important in terms of patient safety. I will let the doctor know as well. What were you doing before the pain started?
I just got back from a short walk.
Can you describe the pain? How does it feel like?
Like pressure
Where's the pain? Does it radiate anywhere?
in the chest towards the left.
What would you rate your pain out of 10, with 10 being the worst pain you've ever felt?
About 6, but it was so scary.
When did it start hurting? Is it still hurting just as much now?
Just before I pressed the buzzer, it still hurts.
We're just going to check your ECG. Can I listen to your heart while she sets the ECG up?
Okay.
I'm just going to give you some medication that might help you relieve the pain, okay? Check patient ID, medication order, allergies and contraindications. Administer nitroglycerin sublingually. Monitor every 5 minutes. If there is still pain, escalate the situation. Do you still have any pain?
It's slightly better now.
Doctor, you're finally here. This is only just one example of the many cases that Physical can reenact. With 12 preset cases, plus your own customizable cases, there are many learning opportunities with Physical. Thank you for being part of Physical's healthcare journey.
Assalamualaikum warahmatullahi wabarakatuh. Siang ini kita akan segera mengikuti kegiatan seminar daring atau virtual seminar dalam rangkaian Clinical Skills Laboratory Webinar Series, kali ini dengan tajuk Improving the Quality of Clinical Skills Lab Activity During Pandemic Era. Sebagaimana telah sama-sama kita maklumi dan rasakan bahwa era pandemi COVID-19 yang menyerang dunia saat ini telah menimbulkan satu perubahan yang signifikan dalam berbagai aspek kehidupan kita, termasuk dan terutama dalam hal pendidikan. Di masa pandemi ini, kegiatan pembelajaran mau tak mau harus berubah pola dari kegiatan tatap muka menjadi pertemuan berbasis digital. Bagi pendidikan kedokteran yang syarat dengan latihan keterampilan, hal ini tentunya menjadi satu tantangan yang luar biasa. Banyak institusi yang telah berupaya untuk beradaptasi dengan kondisi ini melalui beragam inovasi pembelajaran yang prinsipnya meminimalkan pertemuan tatap muka. Namun tentunya banyak di antara kita yang masih kesulitan dalam proses adaptasi ini. Untuk itulah Indonesian Skills Lab Network and Development atau yang disingkat dengan ISLaND mengundang Bapak dan Ibu para praktisi pendidikan kedokteran untuk mengikuti rangkaian seminar Clinical Skills Lab ini. Among us, we have distinguished speakers. Nguyen Van An, MD, MHPE from Hanoi Medical University. Welcome, Dr. Nguyen. We also have Dr. Widyandana, MHPE, PhD ophthalmologist from Faculty of Medicine, University of Gajah Mada. Welcome, Dr. Doni. And finally, Mr. Silverio de Sousa Mendes. Good afternoon, Mr. Mendes, from Body Interact Incorporation.
Terima kasih.
You're welcome. The speakers are experts in respective fields. We expect to hear from the first two speakers about their experiences in conducting skills lab activity in their own settings during this pandemic era, whilst Mr. Mendes will show us that clinical skills training is also possible by using virtual patient. Perlu kami informasikan bahwa kepada para peserta bahwa daftar hadir nantinya akan kami bagikan tautannya pada menjelang akhir acara. Sekaligus Bapak dan Ibu kami harapkan untuk dapat mengisi survei umpan balik kegiatan bersamaan dengan pengisian daftar hadir tersebut. Bapak dan Ibu yang kami hormati, sejatinya acara kita ini akan dimulai dengan kata sambutan oleh Ketua AIPKI sekaligus peluncuran buku panduan keterampilan klinis. Namun berhubung Prof. Budu belum hadir, maka kita lanjutkan saja kepada acara inti, yakni acara seminar. Baiklah, untuk tidak memperpanjang mukadimah, kita masuki materi seminar. Narasumber pertama adalah Dr. Widyandana, MHP, PhD, SPMK dari FKK MK UGM Yogyakarta. Beliau akan membawakan topik Optimizing Learning Resources and Networking in Skills Laboratory. Saya akan bacakan secara ringkas biodata beliau. Dr. Widyandana merupakan staf pengajar di FKK MK UGM Yogyakarta. Beliau merupakan dokter lulusan FK UGM, S2 dan S3 beliau dalam bidang pendidikan kedokteran dari Maastricht University, the Netherlands. Sementara itu, beliau juga merupakan ahli ophthalmologi dari FK UGM dan baru saja memperoleh gelar konsultan dalam bidang neuroophthalmology dari Moran Eye Center, Utah University, Amerika Serikat. Fokus penelitian beliau selain dalam bidang neuroophthalmology juga adalah interprofessional education dan clinical skills. Saat ini beliau aktif sebagai Ketua Program Studi S2 Ilmu Pendidikan Kedokteran UGM, di antara beberapa jabatan penting lainnya, baik di dalam maupun di luar kampus. Bapak dan Ibu, demikianlah biodata singkat namun cukup mengintimidasi ya dari Dr. Doni di usia yang masih relatif muda. Beliau sudah accomplish many things. Kami undang Dr. Widyandana untuk menyampaikan materi beliau. Silakan Dok, waktunya 20 menit.
Ya, terima kasih Mbak Elmi. Saya panggil Mbak biar kelihatan muda. Ya. Good afternoon, Mr. Silvio de Sousa Mendes. Nice to see you.
Good afternoon. Nice to see you.
Good afternoon for my friend Nguyen Van An from Vietnam. Also nice to see you.
Hello.
I ask your permission. I will present in Indonesia because most of our audience is from Indonesia. But my start in English, so you can also see the slide and you can also ask question in the chat room if you have any question. Okay. Ya, selamat sore untuk semua peserta webinar. Webinar Island ini konsepnya santai, jadi kita santai banyak diskusi nanti mengenai optimizing learning resource and networking in Skills Lab. Mungkin bisa dibantu sharing slide-nya dari panitia. Muncul slide-nya? Dari panitia? Kurang diklik satu kali lagi kayaknya itu. Ya, terima kasih, bisa di full screen. Jadi topik saya kali ini mengenai bagaimana kita mengoptimalisasi learning resources dan networking untuk skill lab. Jadi kita tahu bahwa skill lab ini penting untuk kita bersama, sehingga moga-moga nanti apa yang saya sampaikan ini bisa menginspirasi. Ya. Berikutnya slide. Mungkin bisa di slideshow ya, full screen aja. Di full screen saja mungkin, ya. Ya, rencana kita mau buat polling, tapi nanti saja mungkin. Ya, slide dulu. Next slide. Ya, bisa di slideshow aja biar full screen. Ya, kita tahu bahwa Skills Lab itu sangat penting untuk pendidikan. Jadi ada yang mengatakan itu ibaratnya seperti backbone, ya, jadi seperti tulang belakang untuk pendidikan. Jadi saya rasa ini konsep dasar yang harus kita pegang. Jadi kalau kita ingin pendidikan pembelajaran mahasiswa kita bagus, ya, Skill Lab, dari Skill Lab bisa kita perbaiki, yaitu bisa membuat semuanya lebih baik. Ya. Slide. Di slideshow bisa nggak ya, di enable editing. Ini hostnya enable editing, terus di slideshow ya. Ya, terima kasih. Nah, masalahnya sekarang sedang kondisi pandemi. Jadi karena ini kondisi pandemi, sehingga tantangan untuk pendidikan keterampilan medis itu menjadi lebih besar. Kita tahu bahwa tadi karena Skill Lab ini adalah backbone dari pendidikan kedokteran, kesehatan, keperawatan, bidanan, itu Skill Lab penting sekali karena kompetensi kan terdiri dari 3. Ada teori, ada skills, kemudian ada attitude. Nah, skills ini mau nggak mau harus diajari lewat Skill Lab. Nah, masalah sekarang adalah kondisi pandemi, sehingga kita tidak mungkin menjalankan pembelajaran seperti biasa kemarin sebelum pandemi. Nah, ini menjadi tantangan kita. Ya, slide. Nah, kalau kita mau belajar mengenai ilmu pendidikan, kita juga melihat nanti secara teori ya di publikasi-publikasi sebelumnya, kita mau tidak mau harus mengoptimalisasi pembelajaran online untuk mensolusikan tantangan pembelajaran skill lab tadi. Ya, jadi apapun yang sekarang bisa digunakan untuk pendidikan jarak jauh, ya, tanpa harus ketemu, itu bisa kita optimalisasi sekarang ini. Kita tahu bahwa solusi mau tidak mau ya online learning. Jadi mau tidak mau kita harus membangun platform untuk pembelajaran skill lab ini melalui online. Ya, slide. Nah, masalahnya adalah sekarang ternyata pembelajaran online itu tidak mudah. Ya. Kita perlu suatu kreativitas dalam mendesainnya. Masalahnya adalah kreativitas kita itu kan tidak bisa sembarangan. Kita harus merancang suatu pola pembelajaran yang itu bisa memfasilitasi keterampilan medis, ya keterampilan klinis, tapi secara online dan itu mudah dipahami, dan nanti kalau kita assess, ya kita uji, ya mereka lebih terampil juga dari pembelajaran itu, ya, sehingga ini tidak mudah. Ada dua prinsip penting dalam pembelajaran klinis, yang itu keterampilan bisa kita ajarkan, itu ada dua hal. Pertama adalah sinkronus, ya desainnya, dan asinkronus. Ya, slide. Pertama, kita akan memahami konsep ini dulu, karena kita membicarakan mengenai pembelajaran keterampilan medis di era pandemi, ya, dan ini kita mau menggunakan online. Ini ada dua prinsip ini yang harus kita pahami. Pertama mengenai sinkronus, yang kedua nanti mengenai asinkronus. Sinkronus design ini artinya apa? Kita live. Jadi mahasiswa itu belajar di waktu yang sama. Jadi instrukturnya live, kita seperti sekarang ini sinkronus ini. Jadi webinar dengan diikuti peserta online langsung, kita ajari keterampilan seperti ini, ya live, itu sinkronus. Asinkronus yang seperti apa? Itu yang tidak live, jadi recording. Jadi ini kan direkam ya, itu rekamannya itu nanti boleh ditonton siapapun melalui YouTube kapan saja, di mana saja. Nah, itu asinkronus. Nah, ini dua konsep yang harus kita pahami. Apakah pembelajaran tadi perlu sinkronus atau bisa asinkronus? Ini kita bisa lihat di teori di sini. Ya, bisa video konferensi, bisa live chat, bisa streaming video, itu kalau sinkronus. Dan kita bisa lihat di sini komunikasi dua arah itu bisa terjadi ketika sinkronus. Kemudian engaging, ya, kemudian effectiveness itu bisa juga ditingkatkan dengan sinkronus. Kenapa? Karena kita bisa berkomunikasi langsung. Kemudian kita bisa langsung tanya jawab untuk klarifikasi, kita langsung memberikan feedback ketika mereka perform, mahasiswa di skills lab atau di tempat mereka kos, di rumah masing-masing, ketika mereka belajar memeriksa mata atau pasang infus atau apapun, ya CPR, itu bisa kita lihat melalui video, kita bisa langsung memberikan feedback. Itu kalau sinkronus. Masalahnya, kalau kita tidak bisa menyelenggarakan secara sinkronus semuanya, kita juga bisa mendesain asinkronus. Jadi tidak harus sinkron. Jadi kita rekam video gitu, kemudian mereka nanti menonton videonya nanti. Kita bisa kirim melalui email, ya. Bisa screencast, bisa flipgrid ya video, ya. Kemudian bisa kita posting melalui blog, nanti mereka bisa komen kapan saja. Ya. Ini komunikasinya tidak live, tidak langsung, tapi kita bisa juga menjawab komunikasi komen-komen mereka. Seperti kalau kita lihat di media sosial, itu di Instagram, Facebook, itu kan orang komen bisa kapan saja. Tapi ketika meresponnya itu kita juga bisa ketika kita sedang live. Kemudian di sini lebih nyaman memang kalau asinkronus. Kenapa? Mereka bisa menyesuaikan waktu, yang biasa bangun pagi bisa pagi hari akses, yang biasa bangunnya siang bisa agak siang, yang suka sampai malam juga bisa mengakses di malam hari. Kemudian kita juga bisa meminta mahasiswa untuk mengakses, berlatih sesuai dengan irama ritme mereka sendiri. Kecepatannya mereka juga mungkin berbeda, itu bisa kita akses dengan dua konsep ini. Sehingga apa? Kalau kita mau mendesain pembelajaran keterampilan medis di ISLab dengan online karena era pandemi, kita bisa menggunakan dua prinsip ini. Ya, slide. Nah, ternyata pembelajaran online ISLab ya itu tidak semata-mata bisa berjalan lancar dengan sinkronus dan asinkronus tadi. Kita membutuhkan dua aspek lagi yang harus kita lakukan. Yaitu pertama adalah intensive supervision, ya kita mensupervisi mereka ketika berlatih, memberikan feedback, nah, itu penting. Yang kedua, kemudian kita juga memastikan ada aturan yang jelas. Ya, reward, punishment, peraturan, aturan main yang jelas itu ternyata penting sekali untuk mengkontribusikan, memantau kontribusi mahasiswa dalam program keterampilan medis yang kita laksanakan. Jadi ingat, tadi selain mendesain sinkronus asinkronus, kita juga harus memprogramkan bagaimana supervisinya dan bagaimana aturan mainnya. Namanya mahasiswa itu ada bermacam-macam. Ada yang sangat rajin, ada yang sedang-sedang saja, dan ada yang sangat malas. Kita harus memastikan mereka semua tersupervisi dan mengikuti program dengan baik. Sehingga apa? Aturan main ini harus kita buat dengan jelas. Apalagi yang terkait dengan penilaian, itu sangat diperhatikan mahasiswa kita. Jadi ini penting, harus kita perhatikan dua hal. Ya, lanjut. Nah, kalau kita membicarakan intensive supervision dan real regulation ini, kita harus tahu bahwa ya kondisi pandemi ini di era new normal ini tidak semata-mata orang terus nganggur. Jadi kita juga harus menyadari bahwa dosen itu juga sibuk. Mahasiswa itu juga sibuk. Mereka juga mungkin punya aktivitas lain, mungkin aktivitas pembelajaran blog atau tugas-tugas yang lain, sehingga mereka juga harus lakukan itu. Mereka juga mungkin punya pekerjaan di rumah yang harus mereka juga lakukan juga. Sama seperti dosen. Jadi mungkin ada webinar, mungkin ada rapat-rapat, mungkin ada perkuliahan, sehingga tidak mungkin dia mensupervisi mahasiswa keterampilan itu terus-menerus. Nah, sehingga mungkin pembuatan formula bagaimana membuat sesi sinkronus dan asinkronus tadi harus seimbang. Kenapa? Karena kalau kita lihat ilustrasi di sini, ya kondisi ini bisa terjadi. Jadi mahasiswa itu juga tidak nganggur di rumah. Sehingga kita harus memahami posisi itu, sehingga regulasi dan desain yang pas itu penting kita formulasikan bersama-sama. Ya, right? Nah, bagaimana dengan institusi yang fasilitasnya itu terbatas? Tadi kalau kita membicarakan mengenai bagaimana mendesain program, kalau di sini kita tidak hanya ngomong mengenai optimalisasi infrastruktur, peralatan, dan lain-lain, sumber daya yang ada, tapi di sini kita akan mengoptimalisasi networking. Karena ISLaND ini memang dibuat untuk membuat network ISLab se-Indonesia, ya, baik di kedokteran, keperawatan, dan kebidanan mungkin bisa difasilitasi, tapi memang yang sekarang sedang berjalan ini dari kedokteran, ya, itu ternyata apa? Semua institusi itu siap untuk pembelajaran online. Sehingga kita di sini perlu membahas suatu formula networking yang mungkin bisa membantu antara institusi yang kuat dengan yang masih kekurangan tadi. Kita bisa lihat ya, networking yang bisa kita buat di sini adalah mungkin bisa produksi media ajar, ya, resource untuk online-nya, platform online, ya mungkin kalau yang gratisan itu masih sulit digunakan, bisa menggunakan yang berbayar tapi berkolaborasi dengan institusi lain. Ya. Kemudian kita juga bisa sharing untuk pembelajarannya, media modul, kemudian dari narasumber. Nah, ini networking ternyata juga menjadi solusi kalau di era pandemi ini ternyata institusi kita bisa kesulitan menerapkan pendidikan keterampilan medis, kita bisa menggunakan networking ini untuk mengatasi masalah bersama. Jadi tadi pertama optimalisasi media yang ada online, kemudian yang kedua adalah networking. Ya, slide. Nah, salah satu bentuk untuk kiat sukses dalam pembelajaran keterampilan medis itu bisa kita gunakan sharing facility. Jadi tidak menutup kemungkinan ketika ada suatu platform yang sudah established di suatu institusi yang sudah kuat, itu bisa disaringkan dengan institusi lain untuk benchmarking, studi banding, atau mungkin memang berkolaborasi untuk pembelajaran. Ya. Kemudian bagaimana mengkolaborasikan komunikasi jarak jauh, ya, distant communication tools, kemudian bagaimana memanage sumber daya tadi, ya. Kemudian bagaimana kita mengaktifkan mobile learning, ya, dengan handphone, ya, untuk messaging, untuk pengerjaan tugas, untuk merekam, untuk mengupload. Nah, saya rasa sharing facility ini penting, juga perlu kita pikirkan kalau ada institusi yang kesulitan fasilitas dalam pembelajaran skill lab. Ingat, Bapak Ibu tidak sendiri, jadi menurut saya optimalisasi online tadi kalau masih ada masalah untuk era pandemi seperti ini bisa berkolaborasi. Saya yakin semua institusi kalau di kontak untuk berkolaborasi ya nanti senang-senang saja. Ingat, tapi kunci dari kolaborasi networking yang langgeng, yang bisa tahan lama, itu adalah saling memberikan manfaat. Jadi bagaimana sharing benefit itu perlu dikonsepkan agar kolaborasi nanti bisa tahan lama. Ya, slide. Ya. Kemudian setelah kita berkolaborasi, ya mengoptimalisasi online, ternyata kita juga harus memperhitungkan ini, yaitu mentraining dosen yang terlibat. Karena ketika nanti sudah didesain online-nya bagus, ya, kemudian fasilitas website, kemudian platform online-nya sudah disetting dengan baik, sinkron, asinkron sudah disetting, ternyata apa? Dosennya gaptek. Dosennya nggak paham bagaimana mengakses itu. Jadi masalah juga. Sehingga apa? Menurut saya, training juga harus dilakukan. Training terhadap dosen, training terhadap mahasiswa, dan stakeholder yang terlibat. Jadi mungkin dosen jejaring, mungkin dosen lapangan, atau mungkin petugas admin, itu juga perlu dilakukan training. Ya, slide. Ya. Itu saja yang mau saya sampaikan. Secara umum bisa kita simpulkan di sini bahwa ternyata apa? Ternyata optimalisasi pembelajaran online, kemudian networking, dan kita pelatihan staf tadi memang penting kita lakukan. Kalau kita berbicara mengenai keterampilan medis, itu kita artinya masuk dalam satu area kompetensi yang harus berlatih berulang-ulang, mendapatkan feedback, dan mendapatkan fasilitas yang benar-benar memenuhi standar. Nah, menurut saya ini perlu kita optimalisasi, ya, dari teaching staff-nya, dari bagaimana menjadwalkan platform yang mau kita gunakan, menggunakan email, menggunakan website, ya, bagaimana kita mengoptimalisasi working group, ya, biar mereka bisa optimal, kemudian bagaimana kita melatih dosen dan mahasiswa, ya, yang nanti terlibat di sini ternyata penting. Di selain itu, tentu saja program sinkronus dan asinkronus tadi juga harus kita pikirkan bagaimana kita nanti menyusun sesi pelatihannya dan bagaimana nanti kita menyusun sesi ujian. Jadi menurut saya ini penting sekali, perlu kita sadari bersama, dan moga-moga nanti bisa kita lanjutkan untuk diskusi. Itu aja dari saya kembalikan kepada moderator. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Baik, terima kasih Dr. Doni. Tentunya menarik sekali mengenai inovasi pembelajaran daring ya, yang memang harus kita lakukan mau tak mau pada kondisi saat ini, dan tentunya nanti akan banyak sekali diskusi yang akan berlangsung ya di akhir acara. Bapak dan Ibu, demikian tadi pemaparan dari Dr. Doni. Bapak dan Ibu yang memiliki pertanyaan kepada pemateri, pertanyaan dapat disampaikan melalui Q&A room. Mohon disampaikan melalui Q&A room. Bapak dan Ibu juga nantinya dapat menyampaikan pertanyaan secara langsung pada sesi tanya jawab di akhir seminar ini dengan menekan tombol raise hand. Alhamdulillah telah hadir bersama kita Ketua AIPKI, Bapak Profesor Dr. Budu PhD SPM MedEd. Mohon maaf Prof, karena kami sudah sempat memulai acara. Namun kami sangat mengharapkan Prof. Budu dapat memberikan kata sambutan dan membuka kegiatan ini secara resmi, sekaligus melakukan peluncuran buku panduan keterampilan klinis. Kami persilakan Prof.
Baik, terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Selamat siang, kalau di Makassar sudah mulai sore, dan selamat berjumpa kembali. Salam sehat kita semua. Alhamdulillah kita bersyukur kepada Allah Subhanahu wa Ta'ala karena pada siang hari ini kita ketemu kembali dalam sebuah acara yang sangat inovatif sifatnya ini, yaitu webinar seri Clinical Skill Laboratory. Di tengah-tengah kita hadir, kita punya narasumber, kemudian partner. Oleh karena itu, saya mohon maaf karena baru bisa terhubung dari tadi. Saya sebenarnya sudah masuk tapi baru bisa share video, gambar mungkin karena jaringan. Yang sama-sama kita banggakan, hormati kolega dekat, Dr. Wiyandana, ya, MSP, PhD, SPMK yang sangat kita hormati. Kemudian sekaligus ini, walaupun saya lebih tua, tapi Dr. Wiyandana adalah guru mentor saya dulu waktu saya ambil Master Medical Education di Yogyakarta. Saya senang sekali bertemu kembali. Kemudian saya lihat hadir Dr. Superio de Santa. Halo. Thank you. Kemudian juga ada Mrs. Pan An Nguyen di Tikya. Halo. Thank you for your coming and attending this webinar series. Kemudian tentu kita punya partner dekat ini PT Java Medica Utama yang ikut tentu sangat berperanan dalam terjadinya webinar ini. Saya ucapkan terima kasih. Dan moderator kita Mbak Hema, ya. Terima kasih, dan para hadirin sekalian yang sama-sama berbahagia, para pimpinan fakultas, dekan kalau ada yang hadir, atau teman-teman para pemerhati pendidikan kedokteran. Saya selaku Ketua Asosiasi Studi Pendidikan Kedokteran sangat bersyukur karena mulai dari barat sampai ke timur ini selama masa pandemi ternyata kita sama-sama aware sekali terhadap sistem pendidikan kedokteran di masa COVID-19. Tadi saya baru saja selesai acara di webinar di Fakultas Kedokteran Unisar Mataram. Nah, judulnya juga adalah pembelajaran COVID-19 di masa COVID-19 ini. Belum lagi webinar-webinar yang sudah kita lakukan sebelumnya dan yang akan datang. Nah, hari ini kita mengangkat tema Improving the Quality of Clinical Skill Laboratory Activity During Pandemic Era, yang menurut saya memang perlu perhatian khusus ini Karena clinical skill bukan hanya kita butuh knowledge terhadap clinical skill, tapi butuh skill to undertake the clinical skill untuk semua mahasiswa. Nah, untuk meng-hire clinical skill, tentu kita butuh demonstrasi perlakuan langsung kepada objek tertentu dalam hal on-site in laboratory. Kita menggunakan mannequin. Dan itu ada di laboratorium, di institusi kita masing-masing. Tapi saat ini kita lagi learning from home, jadi clinical skill harus di-image-kan di rumah kita masing-masing. Oleh karena itu, how to perform clinical skill during learning from home ini sangat penting. Dan yang menarik juga dan yang perlu diwanti-wanti adalah not just a transfer of clinical skill semata, tetapi juga role model of our tutor, role model of our instructor, kemudian value transfer kepada mahasiswa kita di zaman COVID-19 ini. Kalau clinical skill by online itu perlu sistem khusus. Berikutnya juga bagaimana kemudian menampilkan video dan seterusnya, dan how to make examination of clinical skill like OSCE, sementara antara instruktur atau ex-minors dengan studennya itu berjauhan. Itu membutuhkan metode khusus. Oleh karena itu, ini adalah Clinical Skill Laboratory Webinar Seri 1. Mungkin Seri 2, 3, 4 itu nanti akan akhirnya berseri membahas masalah-masalah secara berjenjang ini hingga akhirnya kita tiba pada suatu kesimpulan yang besar bagaimana clinical skill. Kalau kita lihat tadi materinya Dr. Yandana, kita sangat pikir bahwa clinical skill ini during COVID-19 tidak akan berhenti. Kita punya nuansa virtual sampai post-pandemic sekalipun, saya kira. Jadi tetap kita harus ini. Oleh karena itu, sekali lagi, pada panitia penyelenggara ISLaND webinar seri 1 ini saya mengucapkan terima kasih. Jadi saya mohon izin dan mengajak kepada seluruh hadirin dan hadirat, Dr. Silverio de Sousa Mendes and Dr. Van Nguyen, I would like to ask you to join and I will lead this webinar and open formally dengan mengucapkan Bismillahirrahmanirrahim. Bismillahirrahmanirrahim. Kita buka webinar ini dengan resmi. Kemudian resmilah kemudian webinar ini, dan saya melalui kesempatan ini saya diminta oleh teman-teman panitia juga mohon izin kepada panitia untuk kemudian memasukkan juga, karena Asosiasi Institusi Pendidikan Kedokteran Indonesia saat ini sudah beberapa lama ini menyusun panduan keterampilan klinis untuk Indonesian Skill Laboratory Network and Development tahun 2020, yang bukunya ini ada seri 2. Jadi we just accomplished 2 book for this is panduan keterampilan klinis part 1 dan part 2, ya, Indonesian Skill Laboratory Network Development Methods. Jadi dengan lewat kesempatan ini saya dengan resmi dan mengucapkan Bismillahirrahmanirrahim, saya launching buku panduan keterampilan klinik bagian 1, bagian 2 IPKI dengan resmi. dengan memperlihatkan dua buku ini. Terima kasih banyak, bermanfaat, dan ini akan kita share ke semua fakultas kedokteran di Indonesia dan kepada institusi pendidikan kesehatan yang berminat. Dan sudah beberapa institusi yang memesan buku ini. Terima kasih Mbak Hema Yufi atas fasilitas ini, dan saya mengucapkan sekali lagi terima kasih. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Prof untuk kata sambutan sekaligus membuka acara kita dan peluncuran bukunya. Ini ada pertanyaan Prof. Apabila ada individu atau pihak-pihak lain yang ingin memesan buku ini, bagaimana cara memperoleh bukunya Prof?
Oh ya, bisa menghubungi sekretariat. Nanti akan di-share, hari ini akan di-share kemana harus dihubungi.
Baik, terima kasih Prof.
Ya, terima kasih.
Baik Bapak dan Ibu, demikian tadi Ketua IPKI Prof. Budu telah menyampaikan kata sambutan beliau sekaligus membuka secara resmi kegiatan kita pada hari ini. Dan kegiatan peluncuran buku panduan keterampilan klinis yang juga memang sudah dipersiapkan beberapa tahun terakhir, namun memang penyelesaian bukunya sangat membutuhkan waktu ya Prof. Terima kasih untuk dukungannya dari IPKI yang telah diterima oleh panitia dan tentunya editor buku, penyusun buku selama ini. Baik Bapak Ibu, our next speaker is Dr. Nguyen Tin Van An from Hanoi Medical University. Dr. Nguyen has been a lecturer in Hanoi Medical University since 2005 and currently, among other things, is a deputy director of Center of Assessment and Quality Assurance in Hanoi Medical University, a Vice Dean of the Department of Medical Education and Skills Lab, as well as a sound researcher with many international publications. Ladies and gentlemen, please welcome Dr. Nguyen Tin Van An. Dr. Nguyen, you have 20 minutes.
Thank you, Hema. Hello again, everybody. Thank you very much for having me in the this event, and it's good to be reconnect with other colleagues and friends outside of Vietnam in this special situation. And this is such a good opportunity for me to share my experience from Vietnam for the skill training during the lockdown of COVID-19, and I expect to learn from you a lot, my Indonesian friends and colleagues in medical university, medical education. And in next 20 minutes, I will present to you the situation in Vietnam and what we have done in the social distancing and lockdown time in Hanoi, keeping training for our students in that situation. Can I have my slide, please? Or I share my screen? Okay. As I have introduced, I'm working at the Hanoi Medical University, and my slide will, next slide please, the outline of my presentation will be will present the some introduction about me, about medical education in Vietnam and the Hanoi Medical University. Next slide, please. Yeah, and then some slide about what we have done in during the social distancing and lockdown time, and I will share with you some challenges during this time and the plan what we plan to do in the next academic years, and some additional materials for your information. Next slide, please. Yeah, I think we can skip this slide because I have me to introduce myself. And the medical education in Vietnam, as you see in the map, there's about 11 public medical schools across the nation. Next slide, please. And we have also had some more coming private medical school and the Faculty of Health Science inside the private university or international university in Vietnam. And also we also have the medical school of military and the traditional medical school. And among the public medical school, we have about 7 schools belong to the Ministry of Health, and the other belong to the Ministry of Education and Training. And all of public medical school, we say the common curriculum framework from the Ministry of Education and Training. And each school will have about 20% of the curriculum. They have the flexibility. Next slide, please. And for undergraduate program, we recruit the student directly from high school. They will have a national examination and enter the medical school. And the student enter the medical school normally have the highest mark in the cohort. Last year, my university, they have about 26/30 mark to enter the university. And for the medical doctor track, we train for the medicine, the preventive medicine and traditional medicine and dentistry. We have 2 tracks, 6 years from high school student and 4 years for the student who have a previous bachelor, like a nurse or pharmacy or public health. They can learn, they can study 4 more years to become a medical doctor. And for the bachelor, we train the nurse, the medical technician, nutrition, public health, pharmacy, and ophthalmology for 4 years. And for postgraduate, we have 3 tracks. First, the student can, after they graduate from the medical university, they can have an examination to be a resident doctor. And when we train in 2 years, and they will become a specialist. And the second track is the practice one. We train the student who have graduated and work as a medical doctor in 1 or 2 years, and they come back to the medical school and they study the specialist level 1 and 2. And the third one is the academic track with a master and a PhD degree. Next slide, please. Yeah, and my university is Hanoi Medical University, which located in Hanoi, the capital of Vietnam. Next slide, please. And the university is the oldest university in Vietnam. We established in 1902. With annually, we recruit about 1,000 students for undergraduate and 3,000 students for postgraduate. They will study in about nearly 50 specialties. And we have 1 practice hospital inside the campus. and about 15 ISLaND practice hospital around Hanoi. We have 2,000 staff, and the curriculum, we have two kind of curriculum in at the moment. The L1 is a discipline-based, and the new one is a block-based. And next slide, please. This is the comparison between the skill training in the O curriculum and the new one. You see on the left side of the slide, or most of the in the old curriculum, or most of the skills from basic science communication to the procedure or treatment skill, we train mostly in the hospital. But in the new one, the new curriculum, most of the skills when we train the student prepare, when we prepare in the skills lab, and then we practice in the hospital. Next slide, please. And the skill training in the skills lab, where I'm working as a lecturer, we use the methods, common methods in the skills lab, like role play or the simulated patient. The student will practice in the models on mannequin and using the checklist, and also the video online, and we use the OSPI for the assessment. For each session, a big group, about 20 to 30 students, will have practice under the supervision of one lecturer and one resident doctor who play the role of assistant. And then they will break into the smaller group and practice in the about 20 to 100 minutes. Normally, before the pandemic, the student were requested to watching online video before the skills lab session, but that's not obligation, that's optional. They can watch or not, or skip that. This is some picture of what we of the skills lab. You can see that a group of students with the instructor. Next slide, please. And about the situation in Vietnam, we have the first patient in Vietnam after taste holiday, after the New Year holiday, in the middle of January. And the first patient appeared in Hanoi in March. And two days after that, we have the first social distancing in Hanoi. Social distancing, that means that the people are stay at home, but and wearing the mask in public areas, and stay apart from other people, and not gather in the public areas. And when the situation come back, then we have the first lockdown in 2 weeks. Everybody stay at home, the school closed, and everything is will be going online. Now the situation in Vietnam is we have the second wave of COVID-19 with about more than 1,000 positive case, and 27 died. Yeah, and what we have done in the skill training during social distancing in the skills lab, we have some, for different kind of skills, we use different, different method. Next slide, please. And we use the online learning management system. We use Moodle platform. This platform is, we launched in my university for about 10 years ago, but until COVID-19 it's used. And this in Donnie's presentation, he said that COVID-19 is give a huge challenge, and for us it is, but it also give a big motivation for us to develop and use the online training. Next slide, please. For communication skill, we now ask the student watching the video online before the session. That's obligation. And we split the group into 10 students, and they practice together in half of the time as normal. And after the training, we ask the student to make themselves the video in groups of 5 and submit online, and the teacher will assess the and give feedback through the Zoom for group on about the video. Next slide, please. For the examinations on procedure skill, we also ask the student have to watch online video for the demonstration, and then they practice with group of 10 under the supervision of one tutor, and practice in the model with the models in the skills lab. And for diagnosis and treatment skill, we use Moodle. The lecture will provide the literature and presentation in the Moodles. And then we come to the Zoom, and we split the student in breakout Zoom and discussion the different cases. And they come back with the plenary discussion, and the lecturer will make the summary and answer the question if from the student. Please, next slide. This is the previous slide, please. This working room of a cardiologist. He's a lecturer in cardiologist, and he's you can see that 2 laptop, one for Zoom and one for demonstration the case and the heart sound. And that's very nice that my colleagues share with me the picture. Next slide, please. And during the 2 weeks lockdown, we have worked totally online. Next slide, please. Yeah, the communication skill, we beside from the watching the video online, and now the student doing the role play online under the supervision of teacher, also with via Zoom. And one student will play the doctor, one student will play the patient, and they communicate via Zoom, and the other people will watch and give feedback on Zoom. And after about 1 hour, and then the student will split in the group, in the breakout room, and they will do the role play themselves, and the teacher or the assistant will log in and out of the breakout rooms and monitor the role play. Next slide, please. For the examination and procedure skill, that's unfortunately the school locked down, so we have to stop. And also the hospital, they don't accept the student to come to practice, so we have to stop the practicing those kind of skill, and we have to practice in after the lockdown time. And we push the the skill of reasoning and diagnosis, and we use case study in TBL, team-based learning in the LMS, in the learning management system. And we first the student will watching online the lecture, the examination skill, and the case description, and then they answer the individual MCQ for that's obligation. And then they come to Zoom and working to answer the team's MCQ in the breakout room. And then the the teacher will present case and provide evidence for reasoning and diagnosing in the plenary room. Next slide, please. Yes, and that's what we do. That's what we did in the lockdown time, and we have some challenges. Also, like Donnie have presented first, previous, that that's a very new kind of training for us. So we have spent many time for like training both teacher and student, being familiar with the model, with the learning management system, especially the teacher. Our students learn very fast, but the teacher, they took more time to familiar with the system. And the teacher, they have to like increase workloads a lot, because they have to produce many learning materials for many groups, many cases, and they have to control many teaching in the Zoom. And it's increased workload for the IT staff, for managing the system, and also for teach the student and the teacher using the Zoom. And we also have some Zoom's limitation like security or the internet connection. And the student said that they prefer the face-to-face training, because in online they don't have the like real feelings of interaction with the other and with the other people and other student and the teacher. That's a big challenge. And preparing for the new academic years, which is I believe that is very unpredictable. We plan to using SP in Zoom but before that we have to train the SP using and working via Zoom, providing feedback via Zoom, and presenting them via Zoom, and that's a lot of work. And we like to upgrade the LMS and the internet to have a better system for doing online. And we encourage our teacher, our lecturer, to produce more online or blended courses for the next academic year. And yeah, that's the plan. And the last slide, I would like to share some additional materials. That's the first material is you will see the document that's from the United States. They discuss for the flexible blended teaching. And the second one is a video on YouTube. They discuss about the designing high flex course, being the online and the blended course. And I hope that this material will be helpful for teacher, for you as a teacher in during the pandemic. And that's all for my presentation. And thank you very much for listening. And any question is very welcome. Thank you.
Thank you, Nguyen. That was an interesting exposure towards the setting in Vietnam, and that can be a good example on how to conduct skills training during a pandemic like we're facing today.
Thank you.
And participants who want to address questions to you can write down their questions in the Q&A room. And of course, you can reply directly to the questions in the Q&A room, but you can also answer them in the discussion session by the end of the seminar. Yeah. Thank you once again, Dr. Nguyen.
Okay.
Kami perlu informasikan kembali kepada para peserta bahwa tautan daftar hadir akan kami bagikan di penghujung acara pada chat room. Jadi nantinya daftar hadir tersebut silakan Bapak dan Ibu klik dan isi sesuai dengan apa yang ingin Bapak Ibu isi, nama dengan tulisan yang tepat, karena sertifikat langsung akan Bapak Ibu terima setelah Bapak Ibu mengisinya, jadi tidak menunggu sampai besok. Namun kami tidak memperbaiki ejaan dan sebagainya, jadi mohon untuk menuliskan sesuai dengan yang Bapak Ibu ingin tertera pada sertifikat. Our final speaker is Mr. Silverio de Sousa Mendes, a Chief Business Officer, MBA Sales and Marketing of Take the Win SA Body Interact Incorporation. He's also an executive member of the Corporate Roundtable of the American Society for Simulation in Healthcare, USA. Mr. Mendes has an impressive achievement in digital media, has won many remarkable awards in the field. He has been having a keen interest and passion in developing especially in developing digital technology, particularly used in medical education and training. Such interest is aligned with the commitment of the Take the Win, a company working in developing and providing technology solutions and digital content for medical education since 2008. So it has been 12 years. Mr. Mendes adalah seorang Chief Officer dari Body Interact Incorporation yang sejak tahun 2008 berkomitmen dalam mengembangkan dan menyediakan perangkat digital untuk keperluan pendidikan dan training dalam bidang kedokteran. Ladies and gentlemen, please welcome Mr. Silverio de Sousa Mendes. Mr. Mendes, you have 20 minutes.
Oh, thank you very much. Selamat sore. Unfortunately, I cannot speak many more words. For me, it is a pleasure to being part of this conference, and it is also a pleasure to be in touch with all of you. We know that we live very challenging times right now, but we need to keep giving the classes to the life-size students, for example, and to all the other students also. But we know that we live many challenging times this year. But we are helping the medical schools, the nursing schools, the teaching hospitals, the medical societies, and so on, all over the world, to give them the possibility to keep giving the classes remotely, to keep giving the practical classes also remotely. I will share a small video just only to make an introduction. After I will go by some slides. After we will go all together making a clinical scenario with a virtual patient, because we already know that the real patients are better than the virtual patients, but sometimes we need to access to the virtual patients because the safety part and the casuistic is also different every time that we are accessing with the virtual patients. So I will share right now the screen, a very short introductory movie. Here it was to give you the idea about how the people react to the body interact. The people are happy when they are using the body interact, the teachers and also the students. The central part of the body interact are the teachers, because without the teachers the body interact cannot be useful. And the body interact, it is an innovative didactic approach. It improves the decision making. It improves also the soft skills. It accelerates also the critical thinking using an emotional engagement in a real-time feedback, and it is, without doubts, a confidence booster. We have been making many research papers and all over the world, and all of the conclusions goes in this direction, and goes also in another direction, because the body tract is considered also as a learning accelerator. A learner accelerator for medical and nursing education, and a learning accelerator that all the people can benefit using this kind of tools. We typically use all the people around this big multi-touch table with a life-size real patient, but right now, due to the COVID-19, we are making a different approach, because we are making the distance learning environment, where the teacher can give the clinical scenarios synchronous or asynchronous to each student. The body tract already received some recognitions. We received already the prize in 2016, the Best Product Show Award in the IMSH event in the American Society for Simulation. Recently, we also won a World Summit Awards, that is a prize related to the e-learning products that can be used and can also give benefits to all the community regarding the healthcare area. We won also a prize in the recognition from the United Nations. We also work very, very close with the top medical societies of the world, like, for example, the American Heart Association and many, many others. We also have partnerships at a national level, but this I would like to underline, the global partnerships, because they also review the body tract product, they also review the algorithm, they also review some clinical scenarios. The body tract is useful and it works in two different areas. It works on the area of the pre-graduate education. The main purpose are on the medical and nursing schools, but it also has been very useful on the professional development, on the live events previous than COVID-19, and also on the learning projects that we are keep doing with many, many, many medical societies, many medical and nursing schools. The targets that we serve, there are the medical schools, the nursing schools, the training hospitals, the first responders, the stimulation centers, and also the high schools, and we also have on board the certification providers. I would like to share with you regarding the simulation centers, because in our idea, the simulation centers are a building with 4 walls, and nothing related to the simulation can go outside the simulation center. But with the body tract, it is a little bit different, because the body tract can be used inside the simulation center, but can also go outside the simulation center to a classroom, can go outside the simulation center, for example, to the house of the teacher and to the house of the student. And we cannot compare, for example, with the mannequins and also with the test trainers. Unfortunately, or fortunately, we cannot give them the possibility to give to the students to take a mannequin to their home, to take a test trainer to their home, because it will be not possible. The only way that it's possible to make this distance learning environment, making the practical sessions and not just only the theoretical sessions, it is using also the body tract. On body tract, we have a physiological algorithm that we have been working in this physiological algorithm for 10 years. And it is an algorithm that is very, very, very close to the real world. We have just only one physiological algorithm for all therapeutic areas that we are covering right now. We are covering right now 18 therapeutic areas. And in this physiological algorithm, we have more than 60 interventions, more than 150 medical tests, more than 300 health conditions, and more than 300 medications. These numbers are day to day, they are increasing, and these are the areas that we are now covering. And once the body tract algorithm, it is just only one for all of these therapeutic areas, let me underline to you that if we are dealing with a patient in a cardiology field, and if we administrate something for the respiratory area, as in the real life, it will also impact the patient health conditions to the patient. So the experience is very, very, very close to the real world. That's why also all the medical societies also trust in this product. And that's why also 45 countries all over the world also trust in this Body Interact product, because in this way they can keep giving the classes remotely in a practical way, because it is not so difficult giving the classes online in a theoretical way, but it's very hard when we as educators, we need to give the classrooms in a practical way in this distance learning. But with the Body Interact it is possible. But a picture is better than 1,000 of words, and I would like to invite you right now to solve with me a clinical scenario with a virtual patient. I will select a very simple clinical scenario just only to demonstrate how it works, and just only to demonstrate how it arises our adrenaline. Because another benefit that all the research studies also give us, it is that with the Body Interact we feel the real pressure of the real world, and we feel the pressure of the need to save a life, because the time is running. We have the beep beeps from the simulation, we have facial expressions from the virtual patient, and so on. Yeah, I believe that it will be a huge experience. Right now I will be making alone, but me and Java Medica will also invite you to register in a website that you can also use a couple of clinical scenarios for free. And in this website, you can also give the access to the students, for example, and you can try if they like it or if they did not like it. These specific clinical scenarios, we have simulations just only regarding the COVID-19 clinical scenarios, and we are always updating these clinical scenarios. So I will call the first virtual patient of today's, that is Victor Jensen. It will start with a briefing from the nurse, and let me also underline to you that on Body Interact we have a proportional time. 20 minutes on Body Interact are more or less 1 hour in real life. So it means that all the times will run 3 times more faster. It means that if we ask an EKG, for example, it will appear in 10 seconds. If we ask biochemistry, it will appear in 45 seconds. So we try to keep this proportional time. Let's listen to the briefing from the nurse.
Male, in his 50s, was found collapsed in his office. He has regained consciousness, but he keeps complaining that he is not feeling well. This is the first time he has been admitted to the ER, so no medical records can be found.
So here we have some information that is relevant and some other information that is not relevant. So they are taking the patient right now to the emergency room, and in a couple of moments we will
I'm feeling really tired.
There's not a predefined way to approach the patient. If we would like, we can start giving medication. If we would like, we can start making interventions. We can start making questions and so on. My preference is starting seeing the visual signs of the patient, because the visual signs of the patient are also connected to the algorithm. Here we can see that the patient is sweating a little bit, is a little bit tired because the eyes are not so open, and a little bit pallid. The chest movements they are normal, and the low members, they are also normal. We can go forward making some questions, and although the questions are the same all over the clinical scenario, the questions will be the same, the answers will be different according to the patient health conditions. So it means that if we are performing with very good decisions, the patient health conditions goes better. If we are performing with very bad decisions, the patient health conditions will deteriorate. In these specific questions that are pre-programmed, there are also questions that are first priority that we need to ask. There are questions that are second priority that is not so relevant to ask. And there are many other questions that does not make any sense to ask. But at the final, we will also see how we have performed and what were the items that we made as first priority, as second priority, or not relevant. So right now I will ask regarding the medical condition, how is he feeling?
I'm feeling weak.
I will ask, is feeling any pain?
No, I'm feeling no pain.
I will probably ask regarding the medication, what he's taking.
I'm taking this Gleeman, Damine once every day, and I'm also taking aspirin, also once every day.
And I will ask another question that probably does not make sense. How much he walks each day?
I haven't been walking much, no.
So we can also make the physical exam in the ABCD approach, that we can check the airway, for example. We can see that the airway is open, not obstructed, and no upper abdominal
I'm feeling really
voices.
tight.
We can also go forward, for example, making the pulmonary auscultation. I can drive the stethoscope and I can listen the different sounds. I can also make the chest percussion, that I will touch these predefined hotspots and I will listen feedback based on sound. And I can also make this chest palpation, that are predefined hotspots that I will touch and I will receive the feedback of the patient. We can make it for the circulation, we can make it for the disability. For example, if we want, we can also make the pupil light reflex and we can see if the pupil is reacting or not to the light. And according to different clinical scenarios, we will also have available many other ABCD approach examinations to make it. For example, if we are dealing with a pregnant woman, the exams will be different. If we are dealing, for example, with trauma scenarios, the exams will be different. With the pediatrics, the exams will be different, and so on. Every time that we will go to the ABCD approach, the exams could be different. Now we can start monitoring the patient, for example, and we can see that the temperature, it is okay. The blood pressure is a little bit higher, but I believe that it's not the main problem right now. Here we have a 2-lead ECG, but if you would like, we can order a 12-lead
Just a moment,
ECG.
here is the ECG.
In the meantime, I will also order a
A
biochemistry.
full biochemistry
Then
has
it
been
will-
requested to the lab.
The exams will arrive. We can see that the patient is in sinus rhythm, but I can also call a report that gives me the idea about that the 12-lead ECG, the patient is in sinus rhythm.
I'm feeling really
Every
tight.
exam that we will request, it will be available. For example, if I order
A chest CT scan has been
it's
ordered.
not an exam that is connected to this specific clinical scenario, but it will be also available. So as in a real life, all the things that we will request, it will be available. But at the final, we can also probably receive some penalties. Regarding the lab tests, every exam that is signalized with red, every time that is signalized with red, you can also see that are outside the reference interval. And with this patient, the problem is the blood glucose that is lower. Here we have received also this exam, we can also see the report and so on. But we can also not lose our focus. And our focus will be improve the blood sugar on the patient. I can also make interventions. I will put, for example, I can also put here a catheter, for example. I will put a catheter, a peripheral catheter.
Inserting
but it is
catheter.
just only to work the clinical reasoning. It's not to train the procedure, but to work the clinical reasoning. And now in order to demonstrate how the algorithm happens, I know that I need to give sugar.
I'm feeling really
but I will
tight.
make a mistake. I will give insulin, and I will give intravenous bolus, for example, and I will give 6 units of insulin. Okay, you can punish me because I will probably kill the patient. If you see the patient is not conscious, is not blinking the eyes, if we try to talk with him, he will not answer us. And now the patient causes. So we need to start making the advanced life support.
Applying
Let's make
chest
the manual
compressions.
compressions. Let's connect
Proceeding
also
to
the
intubate.
ventilator. And let's also
Done. Turning
give
on
a little
ventilator.
bit, 1 milligram of adrenaline. So if you see the blood sugar decreases a lot, so we are in a hypoglycemia, and right now we are in a worst hypoglycemia, and we are now making the advanced life support, making the compressions, making with the ventilator, although the patient is cyanotic, because if we see right now the fingers and all the extremities are in blue. So all this is connected. Now the patient is back to life, and we can, for example, the blood pressure is a little bit low, and I believe that we can also improve the blood pressure making crystalloid infusion 2 liters. And I believe that soon the blood pressure will start going up. In the meantime, the blood sugar is 34 milligrams by deciliter, and we can also improve giving, I will also go to the fluids. There's many possibilities to treat. I will go to the fluids and I will give 100 milliliters. Every time that you would like, you can also see what have you been doing all over the clinical scenario. You can see the 12-lead ECG. You can also see the biochemistry that we ordered in the past. We can make everything. If you see right now, the blood sugar increased a lot. So right now it is upper than expected. That's why I will give 2 units of insulin in order to control, because as in a real life, we can also adjust the dosage. If we see they are administrating right now, and it will start making effect just only right now. If you see the blood pressure, we are making a very good job because the parameters are increasing. The oxygen saturation is also increasing. Let me check the blood sugar. It's a little bit below the reference interval. We can also order, for example, another biochemistry.
A full biochemistry has been requested to the lab.
We already know that once the highest parameters is 110, probably we need to give more insulin. But all the other items are keep improving, and I will give just for another 1 unit of insulin in order to have the possibility to decrease a little bit. I believe that it will appear right now, the biochemistry, and we can compare. For example, the previous biochemistry have these results on the right side, and the actual biochemistry have these results on the left side. So we can also compare, and we can also discuss what will be the next good approach to the patient. The blood sugar right now decreased to the parameters that we want, because we want 110 and we have it 117, so we are almost there. And I believe that we can also make some other interventions. For example, I will raise the bath 45 degrees because I believe that it will also help the oxygen saturation to increase once we are raising the bath 45 degrees. In the meantime, once the oxygen saturation is 89, I believe that I can also change to a high flow mask.
1 minute.
And
High
right
flow
now,
mask in
the high
place.
flow mask is available. The oxygen saturation is improving, and I believe that in a couple of moments, the patient now is blinking the eyes, if you see, and I will ask the same previous question, how is he feeling? And
I'm
he's
feeling better now.
So it means that we have very good decisions on the side of our healthcare professionals, and now we have the message telling that we meet the guidelines and we can go to the debriefing. In the debriefing, there's a first question that we will ask that was an hypoglycemia. And the answer was right. And here, for example, if you decide to give the possibility to take this alone at home, they will just only have access to this question. They will perform the clinical scenario, they will give the diagnosis, but they will not see the debriefing tools. But once we are now with a teacher profile, we can also see these debriefing tools. If the student does not will see it at home, the teacher will receive in the learning management system the full detail of the debriefing. And here, in a very fast way, I will promise, I will show you how it works. For example, we have a global score. We have the physical examination that I need to check, for example, the pulse palpation, the capillary fill time that are first priority. And I made also the urinary output that is not a priority in this specific clinical scenario. I already know that I need also to improve a little bit the dialogues with the patient. There's this question as expected, how much he walks each day does not make any sense, but you can see one question regarding second priority and two questions regarding first priority. So I already know that I need to improve a lot in this specific area about the dialogues. I can also see that I applied 10 different competencies regarding the knowledge area in this specific clinical scenario. I check the airway management, I make the pupillary examination, I made the oximetry interpretation, and so on. We can also see the whole timeline of the simulation and what was the impact of our decisions in the untreated conditions of the patient. And we can always understand why and how, because we can also see again the exams and discuss if made sense or not request the exam, this exam, but we can also understand, for example, how and why the patient coded. The vital signs are 0, in previous the vital signs are pretty healthy, just only the blood glucose was orange. And we can understand that the patient entered in cardiac arrest because I gave 6 units of insulin. So there's always a problem. Here at the final, we solved the clinical scenario, although the patient was in a hypokalemia because the blood sugar it is a little bit higher than expected. We can also see what are the reference that the scenario was based, and if the teacher wants, the teacher can also add some resources, and in this way they can also put PDF documents, PowerPoint documents, movies explaining the physiology of the pathology, the guidelines, and so on. This is also a main goal because the teacher can design the learning experience for the student. The teacher can put every other resources that the student needs also to check it after making the clinical scenario. I would like to share with you also, I'm just finishing, I promise. We have a built-in learning management system that allows you to combine a hybrid experience, a hybrid learning experience for the student and also for the teacher. Because we can combine the live classroom and also with the distance learning. And in the distance learning, the teachers also have access to the learning management system of the body tract that they can track the student's activity all over the body tract. They can program, for example, that today from 5 o'clock in the afternoon until 7 o'clock in the afternoon, the students, this group of 13 students will have access to these 2 clinical scenarios to solve, and another teacher at the same time can give to 100 students at the same time 4 different clinical scenarios to solve. And the teachers will also receive each performance of each one student. And they can also download an Excel file that they can also work all of this data, or they can also download a PDF document that they can also see the whole timeline report of each student, for example. As promised, we would like also to invite you to register in this website, covid19.bodyintract.com, because in this website you have a couple of scenarios for free that you can also explore by your own or also with your students in order to check also their feedbacks from this new way to learn. So we need to keep giving the classes to the students. We cannot stop and we cannot give the power to the pandemic to block worldwide all the activities with the students. And we strongly believe that we will help you in Indonesia. Also, we will help you to keep giving all the classes to all the students in these life areas, life science areas, sorry, in order to give them the possibility to make it a really distance online learning experience. And it will be a very good experience also for the teacher, but it also a very an amazing experience also for the students. Terima kasih. And I will be able to answer all the questions that you would like to put me to me and to all the other colleagues for the panel. It was a pleasure for me be in touch with you these moments.
Thank you, Mr. Mendes. There is absolutely an eye-opening experience on how technology can be developed as such that students can gain maximum experience regardless. Of course, the real experience with real patients in real setting is incomparable,
Yes,
but still, this is very sophisticated. I had a feeling that I was watching an episode of Grey's Anatomy.
Thank you very much.
Bapak dan Ibu, demikianlah ketiga pembicara kita telah menyampaikan materi mereka. Dapat kami informasikan bahwa sebentar lagi kami akan menayangkan daftar hadir pada chat room. Ini tibalah kita pada sesi tanya jawab. Beberapa pertanyaan telah kami terima di Q&A room. Now that we are in the discussion session, we have received many questions from attendees in the Q&A room. We are hoping that each speaker can choose up to 3 questions to answer directly in the session. I mean orally. However, you can also give written reply in the Q&A room. But we'd like to suggest that you pick 3 questions that you find most interesting to answer orally so that all participants can follow. I think we can start from Dr. Doni. Dr. Doni, can you please pick 3 questions to answer directly in the discussion session so that everyone can follow you?
Oke. Ini kok video saya nggak keluar, nggak tahu kenapa ya. Tapi suara saya bisa didengarkan ya?
Bisa, jelas Mas.
Saya di depan kamera tapi nggak kedetek sama kameranya.
Iya.
Ya udah, oke.
Saya pikir tadi di balik pintu itu Mas.
Mungkin ya. Ya udahlah. Bentar ya. Jadi tadi ada satu pertanyaan yang menarik mengenai, bentar.
Sih mungkin Mas.
Jadi mengenai assessment ya untuk keterampilan medis di era pandemi. Tadi banyak sekali yang tanya, jadi saya pilih satu ini. Jadi di era non pandemi, era normal, kita kan memang menggunakan OSCE ya untuk ujian keterampilan medis. Tapi kita harus tahu bahwa konsep dasar dari ujian keterampilan medis itu adalah observation based test. Jadi bagaimana kita mau diobservasi ya, diuji ya, tapi di situ nanti kita bisa menggunakan media yang ada untuk bisa mengobservasi keterampilan mahasiswa tadi. Nah, bentar ini lagi untuk itu menurut saya yang penting kita harus perhitungkan di sini adalah kalau kita mau menggunakan online untuk ujian keterampilan medis, berarti kita tetap harus menggunakan prinsip observation based test. Jadi kita harus melihat performa mahasiswa, kemudian memberikan nilai atau memberikan feedback di situ. Nah, di sini keluar ya gambar saya, walaupun kurang jelas. Ya. Di sini kita harus memperhitungkan nanti video itu nanti observation based test-nya itu mau menunjukkan apa, itu yang utama. Jadi apa yang harus diperhitungkan di situ adalah kriteria dalam memvideo ketika kita menilai. Jadi ketika mereka diminta untuk memasang infus, misalnya di manekin gitu, nah nanti memvideonya itu angle mana yang harus jelas, mana yang harus di zoom. Nah, asal kita kriteria yang tadi sudah jelas, saya rasa tidak masalah. Jadi itu yang menurut saya harus kita perhitungkan kalau menggunakan OSCE, menggunakan online. Nah, kita bisa menggunakan live videonya dan juga bisa menggunakan asinkron, jadi bisa direkam, kemudian dikirim ke penilai, nanti penilai memberikan feedback dan memberikan nilainya. Jadi memang kalau kita lihat di sini memang masih banyak kekurangan dibanding offline, tapi tetap menurut saya karena era pandemi ini semuanya darurat ya, jadi itu bisa kita gunakan, menggunakan media video recording. Itu aja dari saya Mbak Heru. Mungkin selanjutnya yang lain dulu, silakan.
Baik, terima kasih Dr. Doni. Memang pertanyaan mengenai assessment ini karena harus berlangsung secara jarak jauh juga ya, tentunya banyak hambatannya karena bagaimana kita sebagai penguji atau dosen pembimbing bisa mengetahui apakah mahasiswa melakukan dengan tepat apa yang diharapkan ya dan sebagainya. Ada pertanyaan terkait dengan perubahan kurikulum, Mas. Perubahan kurikulum pada masa pandemi ini dengan penggunaan teknologi yang berbagai inovasi ini, apakah perlu disusun kurikulum telemedicine dengan demikian untuk kedepannya? Silakan, Mas.
Ya, terima kasih. Tadi sudah saya jawab online, jadi namanya kurikulum menurut saya tidak menunggu pandemi. Jadi kurikulum itu harus kita selalu inovasi, karena itu dinamis ya, metode pembelajaran, desain pembelajaran, kurikulum, assessment, semua itu dinamis. Jadi menurut saya momen adanya pandemi ini bisa menjadi sarana kita untuk pembelajaran yang lebih baik. Tapi sebenarnya kita harus paham bahwa tanpa ada pandemi pun sebenarnya inovasi tadi harus ada. Nah, di kurikulum menurut saya, karena ini sedang era new normal, pandemi, itu harus segera ada inovasi kurikulum di tahap tanggap pandemi dan nanti juga jangka panjangnya setelah pandemi. Jadi menurut saya sekarang ini memang saatnya momen semua institusi untuk mulai memberikan inovasi tanggap pandemi. Jadi kurikulum keterampilan medis, SkillsLab, tim SkillsLab kumpul, kemudian men-setting lagi kurikulum pembelajaran mau seperti apa, ujiannya nanti mau seperti apa. Itu. Jadi telemedicine juga menjadi suatu materi yang bisa disampaikan menurut saya, karena kan ini sekarang era industri 4.0, jadi telemedicine, terus konsultasi online, menggunakan mobile app, kemudian mengoptimalisasi medsos misalnya, itu mungkin kalau bisa untuk head promotion, kenapa tidak dimasukkan dalam kurikulum. Jadi menurut saya hal seperti itu sebaiknya tetap dimasukkan karena itu menanggapi perkembangan zaman ya. Jadi biar kurikulum kita tidak kuno, ya, itu penting. Ya.
Baik, terima kasih Dr. Doni untuk jawabannya. Pertanyaan-pertanyaan yang lain sudah dijawab oleh Dr. Doni langsung ya pada Q&A room. Untuk memang mengefisiensikan waktu, maka kita tidak menjawab semua pertanyaan melalui oral ya. Berikutnya pertanyaan kepada Dr. Nguyen. Next for Dr. Nguyen, can you please speak the question that you want to answer directly, Dr. Nguyen?
Okay, thank you, Hema. I received some question for me. For example, some attendees asked me, when the student study skill, the student come to the university in limit number or just by a virtual? At the moment, we are now very lucky to control the COVID-19 because we have only 1,000, more than 1,000. So we now come to normal, new normal, and the student now come to study the skill at the university like normal. the hospital now are open, but they get just a limited number of patients, so we don't have many patients for the student to practice in the clinical settings. And during the lockdown, not the lockdown, the university closed, so the student couldn't come to the university. But in the social distancing, that the student can come in to the university, but we limited the student working in group in 10, not in 20 or 30 as normal. So that's my answer for the question. Yeah, and the question from Dr. Hardian, that he or she asked about the difficulty for students to do the clinical examination because due to the limited models and mannequins, it's very expensive and it's not easy to access. And also the clinical setting is closed, so we also very worry about the quality of the training for this year, especially this year, and because the students don't have many opportunity to practice, so we open the skills lab at night from 6 to 8 p.m. Then the student can come to practice by themselves. Not under the supervision. The supervision. But I don't think that's the skill lab will open at night will last long because the staff in the skills lab is overloaded. So it's very hard years for us. So and we are working on the solution for this situation. Yeah, thank you.
Okay, how do you see the students' motivation in learning digitally compared to traditional learning? Do you have any evidence on that? Students' motivation.
Yeah, actually, I don't have I don't have time to do a formal study for that, but I asked the reaction from the student that I met during the teaching, and at first they reluctant from the online study because they prefer the face-to-face. But the more they working online, the more they study online, the more they interact with the either by Zoom and breakout room. They said that they now welcome more with working online because they said that it saves time for them, because they can stay at home and don't lose time for travel to the university, and they can study. The time is very flexible for them to study. Yes, but they still prefer the face-to-face. Yes.
Yeah, because learning from the experience of many colleagues, also from you, from your presentation previously, online learning was only used optimally during this pandemic, even though it has been built long before this. What is the optimum proportion based on your experience, online learning compared to face-to-face session?
For me,
yeah. Based on your experience, how many % should we conduct online learning and how many % is traditional one? Let's say that the pandemic is over. Do we still have to keep this online learning?
Yeah, in my experience and from my point of view, I think that after the pandemic, I myself conduct more online training, especially for the reasoning and diagnosis and like analysis the case, clinical case. Because that's very convenient to conduct that online. But for the procedure or examination skills, I think that must be performed in mannequin or in SP or in real patient. And I think the students they are now familiar with the the online course. So I think they also welcome the online course. But our challenge is our staff, our teacher. They still think that working online is more workload, yeah, than the face-to-face. But I think that's if you have time to produce the materials and you give it online, and that will reduce the time for the teacher. I think so. But because they now have to learn themselves many new techniques, so they kind of feel overloaded. But I think that with the time, they will prefer the online course.
Yeah, it's all about the rhythm, right?
Yes, it is. Yes.
Okay, thank you, Dr. Nian. And Mr. Mendes, you have some questions in the Q&A room. Have you checked your questions?
Yes, I checked too.
Okay. Please answer the question.
I will answer to Professor Arjen regarding that if we can create clinical scenario by ourselves or change the existing scenario. We have these two possibilities. We have the possibility to customize an existing clinical scenario based on changing the priorities of the debriefing, putting, for example, the capillary refill time. If it is a first priority, put a non-relevant, or if it is, for example, a chest x-ray, it is not relevant and I can put you also as a first priority. But on the other way, we can also have an authoring tool that allows the teacher to create their own clinical scenarios from the scratch. So if you have an idea, you can create a clinical scenario, and after you create a clinical scenario, between 1 week and 2 weeks, the scenario will be available for be played on the software. On the software integrating on the body interact, because previously we can play it as a graphic bar, just in order to check the coherence of the scenario. I have another question from Professor Drinja. I don't know if I'm spelling correctly the names, right. But I'm doing my best. It is regarding if it is a Bahasa version. Unfortunately, we have 8 different core languages, but we don't have Bahasa. Obstacles to use, there's no obstacles to use, because you can you can use it in a web browser with Mac computer or Windows computer. You can install offline or in Windows computer, Mac computers, but you can also install offline in Apple devices and also Android devices. So it is very easy to use it. Regarding the training and the mentoring, we have it. Every time that the institution wants to go forward with the subscription, we schedule many different training sessions in order to prepare all the teachers, because we never do training sessions to the students, but we give to the teachers, and regarding the software, how it works, the simulator, but also regarding the learning management system, how they will program the sessions, the training sessions, the evaluation sessions, how they will track the students. Because on the body interact, you also have the possibility to make distance learning evaluations, because we also have a tool that you can also create your own OSCEs, and you can apply your own OSCE in each simulation evaluation session that you would like to make. I know that all of us in here in this room, that we are almost 300, we would like to quit the pandemic, and with no doubt. Let me share also another picture that gives you the idea about how you can also work the body interact after the pandemic. After the online learning, how you can also use it. For example, here you can see that is a man here that is touching a body interact system there, sorry. And there's 3 teachers that are evaluating these students. And here, if you see, it is a real patient. It is not a mannequin, it's a real patient. So it means that every time, this is a kind of hybrid simulation, a integration simulation. That is the real world with a real patient, that they can address the questions to the real patient, and the real patient will answer them. But every time that they would like to request a test, every time that they will request, for example, an exam, give a medication, the algorithm of the body interact will play and will show the vital signs, the different exams, and so on. So after this pandemic period, it will be also useful to use and to combine the two best ways to learn around the world, that it is the physical simulation with mannequins and test trainers and the virtual simulation with the body interact. It is just only to share the idea about how you can also rentabilize the way to teach also after the pandemic, also using the body interact possibility to increase the knowledge of the students and give them also the possibility to have access to all the same patients if they are not allowed to go to the hospital, for example, because when we go to the hospital, it is very difficult to have access, for example, for pediatric patients. And here on Body Interact, all the people can have access to pediatric patients. This is an example. Thank you very much for the questions.
Yeah. Mr. Mendes, of course, the participants would like also to know the price of the set, just roughly.
Yes. We have 4 different plans. We have the light plan, the basic plan, the advanced plan, and the premium plan. Each plan has a specific number of clinical scenarios per area. The light plan allows you to select one content package with 10 virtual patients, and this one content package includes one area. The second plan includes to have the possibility to use 30 virtual patients in 3 different areas. The standard package includes the possibility to have the standard package with 50 virtual patients in 5 different areas, and the last one, the premium package, it is the best. It allows you to have up to 70 virtual patients in 7 different areas.
But no price whatsoever.
Yes. It can start around $10,000 per year, and it will always increase. We also have special package, for example, by $5,000. We can combine the different options that the customer would like to have, because we have different package. I will show you right now what are the package that we have it, because we have specific package for specific customers that, for example, the fundamentals of medicine 1, 2, the fundamentals of nursing 3 different package with each one clinical scenario inside. The cardiovascular, the respiratory, the nervous system, the general internal medicine, the trauma, the pediatrics, the pregnancy, for the emergency departments, for the emergency medical technician and emergency medical services, for the paramedics, for the ambulance transportation, for the future healthcare professionals. We have many clinical scenarios, many different packages that we can combine, and we can give a very good experience. Also, we have in our team also instructional designers, and also with Java Medica, we can also design the better learning experience according to the learning objectives of the institution, select the best clinical scenarios to work according to the competencies that they would like to work during a semester, during a year, and so on.
Okay, thank you, Mr. Mendes, for your thorough information.
Thank you very much.
Bapak dan Ibu yang kami hormati, demikianlah seminar kita pada hari ini. Sebagai closing remark, dapat saya simpulkan bahwa kondisi pandemi ini hendaknya tidak menjadi hambatan bagi kita untuk tetap belajar, berlatih, mengajar, dan melatih. Kondisi ini justru akan lebih membuka peluang untuk hadirnya berbagai inovasi dan kreativitas. Dari sisi mahasiswa dan trainee, kondisi ini justru melatih kemandirian dan kemampuan staff center mereka. Sebagai tenaga medis, kita memiliki sumber daya yang, sebagai tenaga pendidik maksud saya, kita memiliki sumber daya yang cukup sebenarnya kita hanya perlu berimprovisasi dan cepat beradaptasi dengan perubahan. Dan bukankah itu merupakan inti dari kemampuan belajar sepanjang hayat, lifelong learning yang senantiasa kita kampanyekan. Tautan untuk daftar hadir sudah dapat Bapak dan Ibu akses pada chat room, silakan mengisinya. Nanti sertifikat akan langsung dapat dikirimkan via email Bapak dan Ibu sekalian. Kami mohon maaf bila ada kesalahan dan kekurangan dalam penyelenggaraan seminar ini. Kami sangat senang dan sangat menghargai kehadiran Bapak dan Ibu sekalian pada kegiatan sore ini. Kami juga mengundang Bapak dan Ibu untuk seminar-seminar kami selanjutnya. Terima kasih juga kami sampaikan kepada AIPKI untuk dukungannya dan tentunya kepada sponsor kami, Body Interact, Incorporation, dan Java Medica sebagai distributor produk Body Interact. Semoga kita dapat bertemu kembali pada kesempatan-kesempatan berikutnya. Akhir kata, billahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Selamat sore and good evening. And for all the panelists, the committee has sent you a link to a Zoom page. You can click on that and you can have an evaluation for the session this afternoon. Thank you very much. Have a nice day and goodbye to you all.
Thank you. Goodbye.
Thank you very much.
Thank you.
Mas Dodi sudah terima tautan untuk ini di briefing?
Mohon maaf, belum.
Belum ya, sebentar saya ini ya. Sepertinya ini ya. Iya, ada di chat untuk panelis. Silakan Mas.
Oh ya, oke.
Iya, kita leave dulu meeting yang ini, nanti kita masuk ke Zoom meeting berikutnya.
Tinggal briefing, tapi kok nggak bisa ya? Apa? Halo.
Dr. Doni? Halo Dr. Doni?
Ya?
Dok, di kolom chat itu kita kirimkan...
Copy button linknya, di copy?
Iya, di copy aja dok.
Oh.
Yang linknya itu aja.
Ya.
Jadi yang ini di lift dulu, kemudian ke kolom buka baru.
Ya, oke.